on to the next speaker, I cordially invite Dr. Vijayanand, along with the chairperson, Dr. Ajil, and co-chairperson, Dr. Jayarooba ma'am, to enlighten us with their knowledge and expertise. To introduce our speaker, Dr. Vijayanand is a distinguished homeopathic physician, academician, and researcher with over 20 years of clinical experience and more than 13 years of teaching and academic leadership. He currently serves as Deputy Director of Research and Development and Professor and Head of Department of Homeopathic Pharmacy at Shree Sai Homeopathy Medical College, Chennai. He is the recipient of the Best Doctor Homeopathy Award from the Tamil Nadu MGR Medical University. He has authored a well-recognized book on homeopathy, organized national and international conferences, and served as a resource person at prestigious scientific forums in India and abroad. His contributions to education, research, and professional leadership have significantly strengthened the field of homeopathy. The stage is now yours, sir.
Good afternoon. I think probably post-lunch, here we have around 30 to 40 people. All are familiar about one word called autism. So myself, Dr. Vijay, as mentioned, working in the area of autism almost for the 2 decades. I always decide to give some take-home message to the audience, whomever sitting in front of me. So I strongly believe whether it is a doctor or a student or an organizer, a simple point of root cause for autism. Now today, whether you are in Chennai or Kerala or India or abroad, US, today born 1 out of 20 child is autistic. It is sad because still people are not finding the root cause. I have been sharing the same point in homeopathy conference, Ayush conference, neurologist conference, many areas. A simple take-home message is autism happens during, the root cause is only during pregnancy. So my aim just to give the message, whomever sitting in front of me, a simple point that autism is not a disease, it is a disorder. The child are considered to be special child, and the root cause of autism is hypoxia. I've shown one picture, a person with a keloid, the other image without keloid. Google defines that keloid cannot be dissolved, but in homeopathy we dissolve and we show the evidence. Because before moving to the autism, everybody asks, do you have evidence? Yes. After crossing 9,000 kids, I have a lot of clinical evidence. I will share you. You go to the ChatGPT, Google, Gemini, wherever, the root cause, they will say either it could be vaccine side effect, or it could be genetical anomaly, or it could be gadgets, virtual autism. But this is what the common slide which you will find anywhere. I strongly believe these root causes are only 5 to 10%. To dramatize, to give you a simple understanding, the villain behind autism is the word called hypoxia. Hope everyone knows what is hypoxia, which is nothing but insufficient oxygen supply to any organ. Whomever we are sitting inside the room, now we are taking around 21% of oxygen. If that supplies, our 80 organs functions well and we are moving forward. Whereas, if hypoxia happens during pregnancy, then the child will become autistic. This I have been sharing almost 2 decades. Recently, Donald Trump was talking only 1 point of paracetamol intake could cause autism, and they have declared it. I'm happy to share this also. And moving forward, the root cause of hypoxia, which happens only during 3 stages, either pregnancy or labor or delivery. That's it. This is the time the root cause happens for any autistic kids. Right from first trimester, the mother would have not taken iron tablet. Second trimester, the baby, if it is genetic, we can rule out hypothyroidism, psychosomatic stress, breech presentation, cord around the neck, less amniotic fluid level. During labor, amniotic fluid reduced less than 8, labor complication, prolonged labor, mechanical compression, melena, baby would have been suffered with dyspnea. So these are all the 30 to 40 events happen. Because of that, hypoxia happens. Because of hypoxia, the autism happens. This is the main root cause, which I strongly believe you will not find anywhere in the Google or ChatGPT or Gemini. Every parent, every child is unique, so definitely every kid root cause is also unique. So where are the diagnostic tool? Do we have any diagnostic tool as on today for autism? Like BP or sugar. BP we can check in the machine, sugar we can do HbA1c. But we don't have. The diagnostic tools are nothing but your neighbor, your teacher, your parents. If a child witnessing signs of autism, definitely we can diagnose it. A lot of people say about CARS analysis, all those analysis. We can do an analysis, but the parent doesn't believe. So moving forward, my point, very simple point is hypoxia. I would like to share to my fellow doctors, this is the key point. Each and every point we can do a research. Simple hypothyroidism, psychosomatic stress also could lead to hypoxia. So coming directly to the addressing the root cause. I don't do any magic. Here many Ayurvedic doctors I've been interacting, they've been talking about gut bacteria. Yes, that is not the root cause, that is a triggering factor. Like a BP, even you take BP tablet, if you're not sleeping properly, you will get BP shoot up. So that is triggering factor. We cannot achieve a cure, we cannot achieve a magic in autism. Of course, we can get improvement. Definitely in Ayurveda, I strongly believe this taking care of the gut health delivers the results, 20%. Moving towards every mother will go for a therapy, either you name it physiotherapy, occupational therapy, ABA therapy, any therapy will deliver the results. Again, that is another 20%. These two modalities every parent will do. That already they are doing it. What else we can do? My unique protocol addressing the root cause with 3 modality. One is, as you know very well, I am a homeopath. I try to treat and address the root cause by homeopathy medicines to address the hypoxia. And we have a hyperbaric oxygen therapy. In Chennai, oxygen therapy has been very well used in wellness centers. Majority of the foreign countries, if you go, you can find in the name of wellness center. All wellness center, they supply oxygen to all organ for the wellness. Here, since the root cause is hypoxia, why not we give oxygen to the brain? So majority clinical evidence also have shown majority of the podologists are using this HBOT for wound healing. So therapeutically it is proven hyperbaric oxygen can be utilized for clinically wellness. So moving forward, I recommend hyperbaric oxygen therapy for all autism kids if the root cause is hypoxia. And the last option, stem cell. Now the upcoming field is stem cell. Plant stem cell, many people are aware. Many people are trying with PRP and hair growth. Now you would have been witnessing. Moving forward, I recommend not the stem cell, I recommend exosomes. Exosomes is a next level of regenerative medicine, functional medicine. It has been applied in multiple fields. So I recommend exosomes for autistic kids. Here, the point is very simple. We are dealing with a brain. Brain functions with a neuron. The problem is not with the neuron, only in the neuroplasticity. It's called axon dendrite connectivity. So, if you are giving exosomes, recent studies have shown exosomes has got a mRNA which can be helpful for signaling, networking and connectivity. And exosomes by vapor, if you give, it can break the blood-brain barrier. நம்ம ட்ரெடிஷ்னலாக பண்ணக்கூடிய மெடிசன் ஆவி பிடிக்கிறதுன்னு சொல்லுவோம். அதுதான் இன்றைக்கி சயின்டிஃபிக்காக ப்ரூவ் பண்ணியிருக்கோம். ஃபாரின் கண்ட்ரீஸ் wherever I go, I talk in the name of traditional complementary medicine. Steam inhalation of exosomes will deliver result in autism. So this is my protocol for autism. I don't depend only on homeopathy. I use multiple modality approach for treating autism. So this is my concept. This is my protocol. where I've been getting very good results: gut health, therapy, homeopathy, HBOT and stem cell. Again, this is something which, how I differentiate. Every child is unique. You can divide the child in 3 categories. Sensory. The definition of autism itself, autism spectrum disorder. The word meaning of spectrum is it has got its own rotation. Many people will get confused what spectrum the child is. Few years sensory problem, few years hyperactivity, few years regression. Even majority of the medical field professional will get confused what to treat, what not to treat. It is the nature, the spectrum will rotate. Sensory, that means fear of sound, fear of light, fear of smell. Kinetic, this, the moment you see the child, we can say autism, but it is not only the kid. You will have regressive state also. The child will go away from the society. These are the spectrum which keeps rotating from the age of 18 months. This is the key point. Day 1, the child will be normal. People believe, doctor believe, everybody says child is normal. The moment 2 years the child is become autistic, the mother doesn't accept. And majority of the doctor, since this area, I'm saying that majority of the doctors himself don't know the root cause and the reality current situation. They say, they just move away from the topic. They will not reconfirm. They just say, simply say, live with this. It is not like that. We can address and we can treat autism. Just to show, this is hyperbaric oxygen therapy where we can supply of oxygen extra for anyone. For wellness also it can be given. Probably right from Donald Trump, right from celebrity like Nagarjuna, everybody is taking this oxygen. So taking oxygen is not something like which is very harmful. If it helps for the autism, then why not we try? Okay, so this is simple. It's, you need like a flight, you go just sit inside, close and come back. That's what hyperbaric oxygen therapy. And this is homeopathy medicine which I commonly use. Many people ask what is the name of the medicine, which is also common in Ayurveda also. In this one point I would like to highlight cannabis indica. There are some studies shows cannabis indica application under lower tongue could open the speech in the brain. So definitely you can try in some research areas also. That also I have been trying. In homeopathy we have, and as per homeopathy we give the high doses. And if this video plays, these are all my patients, witness the improvement. If that video plays, then I think I can play. It's not playing. So as usual, technical error. They are not ready to. It happens. We bring 1 pen drive, 2 pen drive. We go a half an hour break also. Technically error will happen. So that's the reason I bring these pictures. These are all the videos before and after. So I don't always believe. If the videos are there, you can see before and after. Okay, anyway. So these are all little study on the autism and the efficacy of homeopathy medicine, which I have done. You could see that T value and P value, which I have taken a sample of 60 patients and non-autistic, mild, moderate, severe, which I validated pre and post treatment. And these are the checklist which I keep: CARS, AETC, a number of cases. And moving forward, now I've been using neuromarker also in my protocol. We can assess brain neuromarker by taking a urine sample. And recently one more test has come, it's called FRAT test. If folic acid reduced in the brain, then that could lead to brain function imbalance. The test is 75,000 rupees, the treatment is 500 rupees. Folinic acid is the solution. If the autism is due to the, so if autism is due to the paracetamol intake, the folinic acid will give the results. So moving forward, I don't treat only with homeopathy. So I understand the root cause and I try to treat the root cause and I address the root cause. Within 3 to 6 months, the child will improve. And just whatever I wanted to deliver, I hope I delivered. My intention is, let it be 50 or 100 people in this auditorium. Autism, you can see in your community. If you are staying in a flats of a 10, definitely you will come across one autism. Wherever you go, you will see one autism. Now, autism is increasing like anything, and the root cause is nothing but fetal hypoxia. The fetus means the mother's womb during 40 weeks, hypoxia, insufficient oxygen supply. Again, how it is happening, why it is happening, all these things is a bigger topic that we can do later when time permits. So, if Ayurveda or Siddha, any medicine is there to address the root cause, please try on that treating hypoxia. Don't go on the symptoms. Don't go on the investigation basis. Address the root cause and remove the maintaining cause, which already Ayurveda people are doing it. Siddha people, like gut clearance, definitely that will help. And out of the box, you think, if at all Siddha or Ayurveda doctor, my suggestion is don't stick on only your medicine. Out of the box, stem cells and hyperbaric oxygen, this, of course, we also can use it. It doesn't mean that only the modern medicine should people use it. We also can start using auxiliary measures. So create a protocol for any disease, whatever you handle it. So I give as a protocol and I witness within 90 days. And I thank for the organizer. And I hope whoever is sitting inside, I have given few messages. Thank you.
Thank you for your insights, sir. We warmly welcome our chairperson for the session, Dr. Ajil, and invite him to share his thoughts and guidance on this topic.
Yeah, it's a really nice topic and so relevant in the present day situation where we are facing autism. It has become one of the biggest problem for the society. So I would like to ask doctor to explain about HBOT because this can be used with Ayurveda or Siddha or anything. So it will be more helpful if we can explain about this HBOT therapy.
It's a very good question. HBOT in Ayurveda, it has been extremely used in the name of Sri Ravi Shankarji Ayurveda College for cancer patients. Wherever you supply oxygen, wherever you supply extra oxygen, the progress of cancer cells will be arrested. So for a good prognosis, HBOT has been utilized in Sri Ravi Shankarji Ayurveda cancer, exclusive for cancer. I visited the same mission what I have, they also have. And the point number 1 regarding hyperbaric oxygen. Nothing, sir. If now we are inhaling 21% of oxygen. Whereas if I take the oxygen cylinder, if I dive into the sea, if I go below 40 feet, the atmospheric pressure will increase. Then if I take oxygen, 40%, because of the pressure, it saturates to the plasma, it goes all organs, 40% extra. So it is also called as diving medicine. It has been invented for those who work in Himalayas, Jawans, NASA, submarine. So moving forward, when oxygen supply can be delivered, can be increased in organs, then why not we use for wound healing? So especially diabetic wound healing, whoever is handling diabetic wound healing, think of adding hyperbaric oxygen, which has been practically witnessed in Kilpak Medical College. Go to Kilpak Medical College Plastic Surgery Center, hyperbaric oxygen has been used for gangrene amputation, it has been saved. So oxygen supply definitely delivers, improves the functions of cell. Okay, so it is used for wellness. But nobody is thinking of hypoxia. Since I was thinking of hypoxia, hyperbaric oxygen I am giving. So I started creating a protocol of 40 days. If at all mother has to, willing for her parents, the child has to sit with an attender. I give 1.5 to 1.8 ATA pressure for 40 days. If they are interested for exosomes, exosomes are readily available. So it's nothing but we can do a vapor. Just put into the vaporization. See, if you're telling about taking from the bone marrow, sending spinal cord to the brain, people will be panic. So psychologically, as a mother, any mother, if you're telling I'm going to do some vaporization, if it helps, let it help, then they don't mind. Whatever it is, even if you put holy water, you say your child will improve, they're ready. So in that area, I'm using exosomes. So HBOT can be combined with exosomes also, because exosomes is giving another connectivity. So then you supply oxygen. So 20 days of HBOT, exosomes, HBOT. So I hope I answered all your questions. HBOT has been very well utilized for multiple modality. It has been a very good tool. Anybody can try. Yes.
Thank you, Dr. Vijayanand.
Thank you, sir.
It's a wonderful presentation.
Thank you, sir.
Thank you for allowing me, sir. I'm Yoguraj CP. So you said there is a therapy can cure. In terms of therapy, is there yoga can help to cure autism? Would you please explain, sir? Thank you.
Sir, first of all, I never use one word called cure. Cure is possible only for disease. If it is a diabetes, we cannot cure. Whether it's Ayurveda, Siddha, Unani, I strongly believe it is a functional imbalance of the pancreas. You have to manage lifetime. If it is a BP, we have to manage lifetime. Cure, I don't accept. I use the word called improvement. That is possible with therapy. Yoga, Kapalabhati, Pranayama, definitely good. But the supply, we need more. And again, these children, you cannot make them to sit. How can they will pay attention, perception, learning will come. So the challenging task is making the child to sit and do yoga. So it is little obstacle is there. If it is regression, if any children can follow, definitely yes, Kapalabhati, Pranayama, I recommend. Therapy, every mother is a good therapist. Nowadays we are using VR tools, visual reality, because the child want to play games. So give therapy through VR tools. I recommend yoga also. I recommend VR tool also. So whatever is good for that particular kid, whatever the feature we want to address, we have to address. Sir. I hope I answered. Thank you.
Thank you, sir, for your patient explanation for all the queries. We now invite Dr. Shree Varma to felicitate our speaker, Dr. Vijayanand, and present the certificate and memento as a token of our appreciation.